HIV is a virus that attacks the immune system in the body. It also weakens a person's ability to fight infections and disease. There are two types of HIV, HIV-1 and HIV-2. HIV-1 is responsible for the majority of HIV infections globally. The virus is transmitted through body fluids such as blood, breast milk, semen, or vaginal and anal fluids. Common methods of transmitting the disease include having sex with an infected person without a condom, sharing infected needles, or from an HIV-positive mother to her baby during pregnancy or breastfeeding. There is no cure for HIV, and if not caught and treated early, HIV can lead to a condition called AIDS. AIDS is the final stage of HIV infection when the body is no longer able to fight life-threatening infections. However, AIDS can be avoided with early diagnosis and effective treatment. Most people experience a short flu-like illness that occurs between 2 to 6 weeks after the initial infection. Common symptoms of this illness include fever, sore throat, and body rash. Following this, HIV is often asymptomatic for several years, however the infection still remains active. Once the immune system becomes severely damaged and AIDS occurs, common symptoms include weight loss, chronic diarrhea, night sweats, skin problems, recurrent infections, and severe life-threatening illnesses. Although there is no cure for HIV, antiretroviral therapy can prevent the virus replicating in the host and therefore limit the progression of the condition. There are 6 main classes of antiretroviral therapy: nucleoside reverse transcriptase inhibitors, or NRTIs, non-nucleoside reverse transcriptase inhibitors, or NNRTIs, protease inhibitors, integrase inhibitors, fusion inhibitors, and CCR5 antagonists. These classes will be covered in more detail during the student-led workshop. Side effects of antiretroviral therapy can be grouped into 3 main types. These include toxic side effects, which are side effects caused by the drug itself rather than the immune system's reaction to the drug. Toxic side effects are very often dose-related, however factors such as age, nutrition status, and gender can all have an impact on drug metabolism. Therefore, because of individual factors, some people may be at greater risk of developing toxic side effects than others. It isn't always clear whether unwanted side effects are caused by antiretroviral therapy or of a strengthened immune response to infections. However, it is known that people with HIV often have a higher susceptibility to toxic side effects than those who are not immunocompromised. Another group is allergic side effects, which occur as an allergic response to the drug or its metabolites. And finally, timing-associated side effects, which commonly occur in the first couple of weeks after treatment is started. These are often associated with certain times of the day when the drug concentration in the plasma is at its peak. It may be suitable to manage these side effects by adjusting the times of the day when the drug is taken. However, many of these side effects improve after a steady-state plasma concentration of the drug is reached. Although there are many side effects that can occur with antiretroviral therapy, there are 3 common side effects that are associated with treatment. These include immune reconstitution syndrome, which is when an improvement in immune function due to antiretroviral treatment may cause a marked inflammatory response against residual opportunistic infections; lipodystrophy syndrome, which collectively describes metabolic effects associated with antiretroviral treatment, for example fat distribution, insulin resistance, and dyslipidemia. Lipodystrophy is disturbance in the way the body produces, uses, and stores fats. And finally, skeletal conditions, for example osteonecrosis and osteopenia. So, why are these particular side effects so common in HIV treatment? The use of highly active antiretroviral therapy, or HAART, has increased in recent years, which has led to an extended survival rate and a significant reduction of infection in patients. However, the use of HAART is not without its risks. Long-term use of HAART can produce adverse metabolic changes in patients, which can lead to conditions such as lipodystrophy and hyperlipidemia. Lipodystrophy is most commonly seen in patients taking a combination of NRTIs and PIs, whereas hyperlipidemia is more likely to occur in patients taking PIs. These metabolic effects are ultimately risk factors for developing other conditions such as heart disease. However, the benefit of taking HAART outweighs these risk factors.